I have two comments, and one is I have to go back to Kakako, but I like your word about the School of Public Health and Medicine.
Good. Take a vote on it. Take it to the front.
Because you have touched the heart of the problem in terms of resources. Okay? And that's where the real issue is. And what I liked about Jerry's presentation is not very many deans of medicine will be able to make a presentation with some depth, like you did, Jerry, in bringing public health. And whatever you decide about the disciplines, there's a lot of commonality. Because I come from a field where I studied in a medical school which taught public health, and in Asia and in Europe, the methodology and concepts are very close, Australia too. So sometimes the division is in the mind. So I'm going to ask you the question, because you conceptualized it in the community very clearly. Where do you think public health and medicine should be taught to help the cancer patients, the cervical patients? So where does the fit come? Why are they not going early? Are cultural competency training in medical schools not good enough?
I don't think so, because right now I have an uncle who's in his early 60s, and he has Down syndrome, and he's from the Philippines. We not only have language access, we have learning disabilities and Down syndrome to deal with. And I have not met one doctor, and he has gone from doctor to doctor. He is right now in the end stages of lung disease, lung cancer. And it's very sad, because just in how the family deals with it, and when I go with them from healthcare provider to healthcare provider, and you can't even draw blood from him, and he can't even have informed consent, so you have to have a guardian. And even to explain to the family whose second, third language is not English, but other languages, it's very challenging for me, and so it's a really big eye-opener. The way we could draw his blood, you had to trick him into sitting down, and then a family member had to sit on top of him and have a nurse here, a doctor here, and a phlebotomist drawing the blood. Yeah, and to get an MRI, you can't even do that. To have informed consent even for the family, to understand staging, treatment options, diagnosis, all of that out the window. And even Filipinos who don't speak the dialect, very, very different. So I think that public health and medicine needs to be taught in the community, and it needs to be taught at the work site. And it needs to be taught, wherever the people are the most, who needs assessments have found, like where do they work, or not work, where do they live, and have barefoot doctors on bicycles. I would love to see that model. And then you come, and the faculty is just out there in the community. I think you'd save a lot of electricity, and you could save, I think if there are alternative housing areas, and that's where it should be, living places where people can come as aunties and uncles and deans, of different schools come and talk story and cook and clean, and then you will get their stories right there. Too off the wall, I don't know.
Yeah, thank you, Dean Hedges, for coming. I think for all of us that you're willing to have this dialogue means a lot to us. And with 60 people that were in this room, and I counted 18 students, 14 faculty, and I'm an alum. I don't know, do the alums care to raise their hand? And I think the point I would like to point out is that it's in our memory of the wound that we experienced to have the school fall. And it's still, very emotional for a lot of us. But since 9/11, the role for public health has changed so drastically in the world, and particularly in the United States. And I work on Health Disparity Service Learning Grant, and as I mix more, particularly with Pacific Islanders, they want to have public health programs. And I think we're in a situation, if we became a school again, to really help foster public health programs in the whole Pacific Rim. Without the school status, we really don't have the ability to bring in the money that we need. And I think we wouldn't really be here having this conversation if we didn't have a level 5 funding, it would already be blended. It'd be like medical tech or speech pathology. They're all blended in. They're 25th on the list. We're probably 23rd, you know. And all due respect, you're brand new, but we're low on the totem pole. But thank goodness our funding's separate. We have this wound, and we have a tremendous role. And I really appreciate, I have such respect for you. I really appreciate, you know, that we do bridge in every aspect, whether we become a school or not, but it's how can we build up and support and be the leader in the Pacific without a school. I don't see how we can do it. There's too many alums, you know, there's over 3,000, almost 4,000 alums that exist. And we remember this. I remember, you know, right now we have 18 faculty and about 50 active students. I remember when we had 50 faculty and 300 students. This was a booming place. It was so busy. So many people were doing so many projects. And we're not going to forget this until I die, but I got another 45 years. I'm going to keep it alive. And I'm presenting this to you and to the panel because I think you could respond to this. So we have something to deal with that's unique. If we hadn't had this history and then this love in our heart and then this new role that I see for us in the Pacific, I don't think we need this conversation, but I think we need this school.
I come from Thailand, and now I'm doing master degree here in department, in our department. So I will share my idea that I really support the idea to reimagine the School of Public Health at the University of Hawaii. Before I came here, I worked in the Rural Health Center in Thailand for nearly 12 years. And I can say honestly that now the successful in healthy of Thai people, not from the medical doctor, but from the community health officer like me in Thailand. In Thailand, every sub-district we have actually one rural health center to give the comprehensive care. I mean, that's both public health and basic medical care, but almost often we do public health work there. For example, we give the immunization to the children and the students and pregnant women. We help them